Good morning, everyone. I'm Nisnisan, and today I will be reporting about my assigned topic, the Mounier-Kuhn syndrome. So, so what is Mounier-Kuhn syndrome? So, Mounier-Kuhn syndrome, also known as tracheobronchomegaly, is a rare lung disorder characterized by the dilation or enlargement of the respiratory tract, specifically the trachea and main bronchi. This enlargement leads to a weakened airway structure, making individuals susceptible to frequent respiratory tract infections and recurrent coughing. Next, for its signs and symptoms, we have the chronic cough, shortness of breath, wheezing, stridor, and recurrent respiratory infections. For its risk factors, first we have the family history, the connective tissue disorders, smoking, air pollutants, and prolonged mechanical ventilation. So for its pathophysiology, atrophy of elastic and smooth muscle fibers. So the primary cause of bronchomegaly is the denigration or atrophy of the elastic and smooth muscle fibers in the walls of the trachea and bronchi. These fibers are crucial for maintaining the structural integrity and elasticity of the airways, allowing them to expand and contract during breathing. That leads to weakened airway walls. The loss of elastic and smooth muscle fibers leads to a weakening of the airway walls, making them more prone to dilation and collapse, especially during exhalation. Then results to tracheobronchial dilation. The weakened airway walls result in the dilation or enlargement of the trachea and bronchi, creating a larger than normal airway lumen. And then the formation of diverticula. So in some cases, the weakened airway walls can also lead to the formation of diverticula, which are outpatching or bulges in the airway walls. These diverticula can further compromise airway function and increase the risk of infections. Then, that results to impaired mucociliary clearance. The dilation and weakening of the airways can impair the normal mucociliary clearance mechanism, which is responsible for removing mucus and foreign particles from the respiratory tract. This impairment leads to mucus stagnation, increasing the risk of recurrent respiratory infections that may result in recurrent respiratory infections. The combination of weakened airway walls, impaired mucociliary clearance, and mucus stagnation creates a favorable environment for bacteria and viral infections. Individuals with Mounier-Kuhn syndrome are therefore highly susceptible to recurrent bronchitis, pneumonia, and other respiratory infections. Then for its diagnostic test, first we have the chest x-ray. So while not as definitive as CT scans, chest x-ray can reveal an enlarged tracheal shadow and potential bronchiectatic lesions. Next, we have the computed tomography or the CT scan. CT scans are the gold standard for diagnosing Mounier-Kuhn syndrome. They provide detailed images of the trachea and bronchi, allowing for precise measurement of their diameter and identification of the verticula, outpunchings in the airway walls. In adults, the diagnostic criteria include a tracheal diameter greater than 30 mm and the right main bronchus diameter greater than 20 mm. Next, we have the bronchoscopy. So, this procedure involves inserting a flexible tube with a camera into the airway to visualize the tracheobronchial structures. Bronchoscopy can confirm the dilation and identify any abnormalities in the airway walls such as diverticula or inflammation. Next, we have the pulmonary function test. So this test can assess lung function and identify any airflow limitations or changes in lung volumes. Next, for its medical management. So for its medication, medicines to open up your airways, reduce inflammation, and thin mucus. Then breathing treatments, using a machine to help you breathe easier or a scoop to clean out your airways. And lifestyle changes, avoiding things that irritate your lungs like smoke and dust and staying active. For its surgical management, we have the bronchoplasty. This involves surgically repairing the trachea and bronchi by reinforcing the weakened cartilage and stabilizing the posterior membranous wall. We have the tracheal stenting. So, in some cases, a tracheal stent may be used to temporarily stabilize the airway and improve symptoms. This is often used as bridge to surgery or for patients who are not suitable candidates for surgery. Next, we have the laser therapy. So, in some cases, laser therapy can be used to treat tracheobronchial malacia by vascularizing and retracting the tissues, preventing excessive collapse of the airway. This is a less invasive option than tracheobronchoplasty. And lastly, we have the endoscopic procedures. So flexible bronchoscopy can be used to remove mucus plugs and aspirated materials, improve airway patency, and sometimes to treat tracheobronchomalacia. For the nursing management, for the respiratory management, so airway clearance, regular chest physiotherapy, including postural drainage and percussion, is crucial to help patients clear mucus and reduce the risk of infections. So nurses should be skilled in these techniques and teach patients and families how to perform them at home. Next, we have the oxygen therapy. So patients may require supplemental oxygen, especially during exacerbations or when experiencing dyspnea. Nurses should monitor oxygen saturation levels and adjust oxygen flow rates as needed. For the mechanical ventilation, in severe cases, non-invasive positive pressure ventilation or NPPV may be necessary to improve ventilation and reduce the workload of breathing. Nurses should be trained in the use of NPPV and monitor patients closely for any adverse effects. For the medication administration, nurses administer medications as prescribed, including bronchodilators, corticosteroids, and antibiotics. They should also monitor for any adverse effects and educate patients about their medications. So for the infection prevention, first we have the hand hygiene, emphasize the importance of frequent hand washing to prevent the spread of infections. Vaccinations, patients with Mounier-Kuhn syndrome are at increased risk of respiratory infections. Nurses should encourage vaccination against influenza and pneumococcus. Early recognition of infection, nurses must vigilantly monitor patients for signs and symptoms of infection such as fever, cough, increased sputum production, and dyspnea. Prompt reporting of these symptoms to the physician is crucial. Patient education and support. So this is understanding a nurse should provide patient with comprehensive information about this disease, the Mounier-Kuhn syndrome, including its causes, symptoms, and management options. Next, we have the self-management strategies. A nurse should teach patients and their families about airway clearance technique, medication regimen, and infection prevention measure. For the emotional support, living with a chronic condition can be challenging. Nurses should provide emotional support and encourage patients to join support groups or connect with other individuals with Mounier-Kuhn syndrome. So for its long-term management, nurses should reinforce the need for regular follow-up appointments with their healthcare providers to monitor the condition and adjust treatment plans as needed. So for its nursing diagnosis, first diagnosis, we have the ineffective airway clearance related to tracheobronchial dilation as evidenced by chronic cough and sputum production. So this diagnosis is often present due to the enlarged airways which can trap mucus and increase the risk of infection. Patients with Mounier-Kuhn syndrome may experience chronic cough, excessive sputum production, and difficulty clearing secretions. Next, we have the impaired gas exchange related to tracheobronchial dilation as evidenced by dyspnea or shortness of breath. So, the enlarged airways can lead to ventilation-perfusion mismatch, where the lungs are not adequately ventilated, resulting in impaired gas exchange. This can manifest as shortness of breath, dyspnea, and hypoxemia. And last, nursing diagnosis for Mounier-Kuhn syndrome is the ineffective breathing pattern related to bronchobronchial dilation as evidenced by shortness of breath. So patients with Mounier-Kuhn syndrome may experience difficulty breathing due to the enlarged airways and increased mucus production. This can lead to an effective breathing pattern characterized by shallow respirations, increased respiratory rate, and use of accessory muscles. So that's all for my report. Thank you for listening and have a good day.